The Hele Hoof Cushion. Laminitis is by far one of the most dreaded ailments which can befall the horse. It is indeed an emergency which needs immediate veterinary attention. Raising the angle of the heels in the earliest stages by means of plaster, cast or other methods, as well as applying appropriate pharmaceutical treatment, is therefore of utmost importance. However, this is very often difficult to put into practice as the horse is unable to bear weight on one limb for the duration of time required for the plaster to set. Sedation, regional anesthesia, or even general anesthesia can be counterproductive by increasing the risk of further damaging the suspensory apparatus of the third phalanx. The solution to this problem is the elastic wedge-shaped hoof cushion, Hele Hoof Cushion. This hoof cushion can be effortlessly fixed with tape under the hoof in less than 30 seconds and can take the horse's weight immediately. The elasticity of the Hele Hoof Cushion offers far more comfort and better orthopedic support than rigid plaster or cast bandages. Wedges made of wood or of rigid rubber foam can be easily affixed, but the former are too hard and the latter too soft to provide optimal support. The Hele Hoof Cushion assumes the shape of the sole, thus immediately reducing the tension from the suspensory apparatus of the hoof and the digital flexor tendon. The horse experiences immediate pain relief, especially on the bend. The Hele Hoof Cushion can also be applied with excellent results in the acute stages of lesions of the digital flexor tendon and accessory ligament. The tension on the tendons and accessory ligaments is effectively relieved to the maximum by raising the heels. The risk of further injury is clearly reduced and the healing process is accelerated. In suspicious cases such as retained placenta or overfeeding, this system can be used prophylactically with good results. In the majority of cases, the consequences of clinical laminitis, including rotation of the third phalanx and chronic ill-being of the horse, are avoided. The Hele Hoof Cushion comes in variable sizes to suit different hooves. The hoof cushion should not protrude beyond the solar surface in order to offer relief from pressure to the weight-bearing margin of the hoof. If the hoof cushion is being used in cases of tendon or accessory ligament damage, it can be of a larger size in order to wholly support the weight-bearing margin. The hoof cushion can also be applied under the shoe whenever this is difficult to remove. The foot is lifted up and the Hele Hoof Cushion, with a thin edge facing forward, is at first affixed to the toe with 3 or 4 turns of tape. It is then fixed with 3 or 4 further diagonal turns at the heels. It is important to make sure that in so doing, the hoof cushion is not displaced too far towards the heels. Finally, it is important to cover any gaps which may remain, in order to increase the stability and to protect the space between the hoof cushion and the hoof from dirt. On average, the Hele Hoof Cushion, which has been affixed correctly, holds on for a considerably longer time than plaster. If the coronary band has been erroneously included in the bandage, you can slit it open at the top and roll it down. The laborious and tedious task of having to apply plaster bandaging is thus effectively eliminated. for your patient's comfort and client satisfaction. The Hele Hoof Kissen.